Welcome, medical students, to today's lecture on mood disorders. In this comprehensive script, we will delve into various topics related to mood disorders, including neuroimaging findings, genetic markers, circadian rhythms, neuroendocrine dysregulation, neuroinflammation, childhood trauma, cognitive dysfunctions, integrated care models, ultra-rapid cycling bipolar disorder, treatment-resistant depression, bipolar disorder subtypes, and advances in brain stimulation techniques. Let's begin our exploration into the fascinating world of mood disorders. Neuroimaging techniques have provided valuable insights into the structural and functional abnormalities associated with mood disorders. Studies using magnetic resonance imaging, MRI, have observed volumetric changes, particularly in the prefrontal cortex, amygdala, and hippocampus in patients with depression and bipolar disorder. Additionally, functional MRI studies have identified dysregulation in the default mode network and aberrant connectivity patterns in mood disorders. These neuroimaging findings offer valuable clues about the neurobiological underpinnings of mood disorders. Genetic factors play a significant role in the etiology of mood disorders. Various studies have identified a range of genetic markers associated with susceptibility to depression and bipolar disorder. For example, variations in the serotonin transporter gene have been linked to an increased risk of developing depression. Additionally, genome-wide association studies have identified several susceptibility loci for bipolar disorder, including genes involved in neurotransmission, neurodevelopment, and circadian rhythm regulation. Understanding the genetic basis of mood disorders can help in the development of targeted therapies and personalized medicine approaches. Circadian rhythms, the internal biological clocks that regulate various physiological processes, play an essential role in mood regulation. Disruptions in circadian rhythms have been implicated in the development and recurrence of mood disorders. Studies have shown that abnormalities in the expression of clock genes and alterations in the timing of melatonin secretion are associated with mood dysregulation. Furthermore, chronobiological interventions, such as bright light therapy and regulation of sleep-wake cycles, have demonstrated efficacy in the treatment of mood disorders. Neuroendocrine dysregulation, particularly involving the hypothalamic pituitary adrenal (HPA) axis, is a hallmark feature of mood disorders. Dysregulated cortisol secretion and impaired negative feedback mechanisms have been consistently observed in patients with depression and bipolar disorder. Moreover, abnormalities in other neuroendocrine systems, such as the hypothalamic pituitary thyroid (HPT) axis and the hypothalamic pituitary gonadal (HPG) axis, have also been associated with mood disorders. Understanding these neuroendocrine dysregulations can aid in the development of targeted interventions to restore normal hormone levels and improve mood symptoms. Emerging evidence suggests that neuroinflammation plays a crucial role in the pathophysiology of mood disorders. Increased levels of pro-inflammatory cytokines, such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha, have been observed in the blood and cerebrospinal fluid of patients with depression and bipolar disorder. Furthermore, neuroinflammation can lead to microglial activation, oxidative stress, and alterations in neurotransmitter systems. Anti-inflammatory interventions, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and cytokine targeting agents, have shown promise in ameliorating mood symptoms in certain individuals. Exposure to childhood trauma, including abuse, neglect, or adverse life events, has been identified as a significant risk factor for the development of mood disorders later in life. Neurobiological alterations resulting from childhood trauma can contribute to the dysregulation of stress response systems, such as the HPA axis, as well as lead to structural and functional changes in brain regions involved in emotional processing and regulation. Therefore, early identification and intervention for individuals with a history of childhood trauma are essential in preventing the onset of mood disorders. Cognitive impairments are commonly observed in individuals with bipolar disorder, even during periods of remission. These cognitive deficits primarily affect executive functions, attention, and memory. Neuroimaging studies have elucidated abnormalities in frontolimbic circuits, which may underlie these cognitive dysfunctions. Furthermore, cognitive impairments in bipolar disorder have significant functional implications, including impairment in occupational and social functioning. Cognitive remediation techniques and pharmacological interventions targeting cognitive domains hold promise in improving overall functioning in individuals with bipolar disorder. Individuals with co-occurring mood and substance use disorders pose unique challenges for healthcare providers. Integrated care models that address both conditions simultaneously have shown improved outcomes. These models involve a collaborative approach between mental health and addiction specialists, providing comprehensive assessment, individualized treatments, and coordinated care. Integrated care models aim to enhance engagement, reduce relapse rates, and improve overall well-being in individuals with these comorbid conditions. Ultra-rapid cycling bipolar disorder, characterized by the occurrence of 4 or more mood episodes within a year, represents a severe variant of bipolar disorder. Individuals with ultra-rapid cycling bipolar disorder often experience rapid mood fluctuations and are prone to treatment-resistant symptoms. The exact mechanisms underlying this condition remain unclear, but neurobiological, genetic, and psychosocial factors may contribute to its etiology. Tailored pharmacological and psychosocial interventions are crucial in managing ultra-rapid cycling bipolar disorder effectively. While many individuals with depression respond well to standard treatments, a subset of patients experience treatment-resistant depression, TRD. TRD is defined as the failure to achieve adequate symptom relief despite appropriate trials of multiple antidepressant medications. Various factors, including genetic predisposition, neurobiological abnormalities, and psychosocial stressors, may contribute to the development of TRD. Novel treatment approaches, such as ketamine infusions, repetitive transcranial magnetic stimulation, RTMS, and deep brain stimulation, DBS, have shown promise in alleviating depressive symptoms in individuals with TRD. Bipolar disorder is a heterogeneous condition, and different subtypes have been proposed based on several characteristics, including symptom patterns, illness severity, and treatment response. The subtypes of bipolar disorder include bipolar I disorder, bipolar II disorder, cyclothymic disorder, and bipolar disorder not otherwise specified, NOS. Each subtype has distinct clinical features and treatment considerations, emphasizing the importance of accurate diagnosis and tailored management strategies for optimal outcomes. Brain stimulation techniques, such as electroconvulsive therapy, ECT, and transcranial magnetic stimulation, TMS, have long been used in the treatment of mood disorders. Recent advances in these techniques, including the development of accelerated schedules, magnetic seizure therapy, and theta burst stimulation, have further expanded the treatment options available for individuals with mood disorders. These techniques offer an alternative for patients who are resistant to conventional pharmacotherapy or are unable to tolerate medication side effects. In conclusion, the study of mood disorders encompasses a wide range of interdisciplinary topics, including neuroimaging, genetics, circadian rhythms, neuroendocrine dysregulation, neuroinflammation, childhood trauma, cognitive dysfunctions, integrated care models, ultra-rapid cycling bipolar disorder, treatment-resistant depression, bipolar disorder subtypes, and advances in brain stimulation techniques. Understanding the complex interactions between these factors can ultimately contribute to improved diagnosis, treatment, and overall outcomes for individuals affected by mood disorders. As future medical professionals, your knowledge in this field will be instrumental in providing compassionate and effective care to patients with mood disorders.